focused organizations. This is a collaborative multi-agency project. A special thanks to our sponsoring agencies, the Department of Children, Youth, and Families, and the Healthcare Authority. Today's presenters will cover this project in greater detail. But before we get started, Governor, we look forward to hearing from you.
Thank you, and thanks for joining us on another step forward to provide better services to people. Our young people who have had some justice system involvement, we know one of the most effective things we can do is to have peer-to-peer assistance to them. A peer-to-peer relationship is a heck of a lot better than a relationship with a governor. And so we want to maximize those. And we know that this is a continuing effort to try to work across agencies to maximize those opportunities. And the kind of thing we're doing today is to try to take some additional steps in that direction. I want to note that this kind of effort is probably never going to be finished. We always are going to be looking for ways to coordinate our services better across agencies. But I think it's particularly challenging and important in the peer counseling environment when we have so many people who we need to engage who may not be state employees, but in fact are peers of these young folks whose futures can be really bright if we can just get them a little relationship with a peer. So I'm looking forward to figuring out how we can do this. I'll look forward to your ideas and let's get to work. Thank you.
Great. Thank you, Governor. First, we will hear from Ross Hunter, the Secretary of the Department of Children, Youth, and Families. Russ, you are on mute.
Oh, no, I'm not. Good morning. I get an opportunity today to talk about a twofer, which is our youth, the young people who are in our care for juvenile rehabilitation, need a bunch of things to launch successfully, which is one of our strategic goals. And clearly, they need to have sort of the behavioral health and the connection to the community, but they also need to have career opportunities. And working on this peer relationship work allows us to do both. Many of the young people in our care, in fact, almost all of the young people in our care have experienced significant trauma in their life, and they need a chance to talk through it. And as the governor points out, cabinet secretaries are also probably not the best situated people for young people to talk to. And talking to someone with lived experience is incredibly powerful for them. But we have to have trained people in order to provide that level of care. We can get young people the behavioral health supports. We can strengthen their community connection with pro-social people in their community. But we can also provide the young people leaving us with career opportunities, launching out to become a peer counselor. So we're going to talk today about that, our partnership with the Healthcare Authority to grow peer support programs to increase young people's enrollment in the programs that provide the behavioral health supports in the community, and also to get connected to again, pro-social community connection. We're working on trying to increase our agency readiness and partnerships with groups in the community. We're increasing access to peer services in our facilities, and after young people re-enter, we have even more opportunities now with the community transitions program that will have even more young people transitioning out of our care in a graduated way into the community where they're going to return. And we can build career pathways for young people in JR, and a career pathway that makes sense for many of them. So I'm looking forward to hearing that. And I think I get to introduce Sue BIRCH, the Director of the Healthcare Authority.
Thank you, Secretary Hunter, and good morning. I want to thank you for this opportunity to talk a bit about peer supports, which is a foundational element as we build a true and sustainable community-based behavioral health system. We're really excited to partner with DCYF on this effort. What does a community-based system look like? There are a couple of points that I really want to hit home about this. First, when people are closer to their homes and support systems, rather than in large institutional settings away from their loved ones, they're more likely to be successful and access the right care at the right time. And secondly, you often hear the term nothing about us without us. And that really applies to our vision of providing person-centered services. That is to say, the person receiving the care is able to be part of the decision-making. They make the decisions, they receive that personalized care, and they're treated with dignity and compassion. And finally, a community-based system provides linkages and coordination between the medical and behavioral health sectors, and that really focuses on that whole person level of care. So peers really help increase the quality of that care, and they improve the individual experience of care. And they can also really impact the health professionals that are really learning and changing their skill set about behavioral health services and lived experience. Peers also play a crucial role in helping individuals advance their wellness and recovery. And I'm really proud to say that HCA has been promoting peers as an integral part of this behavioral health system since 2005. We see peer services as part of promoting recovery and whole person care. And as a nurse, I'm here to tell you that we're adapting this peer model over onto the medical side of things as well. Things like doulas or death doulas, or things like family navigators, helping primary care doctors understand that lived experience, really important. So HCA's Division of Behavioral Health and Recovery is the credentialing body for the peer training and testing. Now, listen to this. We've certified more than 4,700 individuals since the program began. That's an army of peers, and that is really impressive. Significant research shows that peer support is effective in these ways. Broadly defined, it refers to a process through which people who share common experiences or face similar challenges come together as equals to give and receive help based on the knowledge that comes through shared experience. Peers know what it's like to be in the other person's shoes. They hold and promote hope for recovery. They have a unique and comforting presence and ability to develop that mutual relationship with an individual. They walk beside that person and empower them to increase their self-advocacy and ensure that their voice is heard throughout the service delivery process. HCA has been implementing a type of peer service called Peer Bridger since 2014. Now, this model was based on positive outcomes out of New York, and Washington implemented the Peer Bridgers in every region of the state to help individuals transition from the state hospitals. And you're going to hear more about our program that program from Melody Paisfeld, as well as two of our superstar peer bridgers, both Heather and Charlene. So HCA also has been implementing another service in collaboration with DCYF, which is called WISE, the Wraparound with Intensive Services Program. And this has been going on since 2014. WISE provides mental health services in the home and community-based settings using a team-based approach. So a youth or a family certified peer counselor is required to be part of that team. And HCA is supporting the DCY efforts to expand these peer services and implement a peer bridger program with the JRA facilities. We're providing funding through federal SAMHSA stimulus funds and a system of care funding. We also continue to support agencies that are hiring peers and organizations such as the state hospitals and our local psychiatric hospitals to host peer bridgers in those settings. Parallel to JRA's efforts, HCA is expanding peer bridger services into substance use treatment services, and we're adding peers to our jail transition teams. So lots of work underway, and we're really proud to be partnering with our sister agency.
Great. Thank you, Sue. Thank you, Ross. I will now turn it over to Ted Ryle from the Department of Children, Youth, and Families. Ted?
Thank you so much. Hi, yes, I am the clinical director with juvenile rehabilitation in DCYF, and I want to thank you so much, Governor Inslee and the Results Washington team, our friends at Healthcare Authority, and the distinguished guests and partners who are going to be joining us for this conversation today to discuss the impact and potential of increasing peer services and peer counseling career opportunities for young people we serve in JR. So Young people in our care are increasingly older. They're disproportionately Black, Indigenous, and people of color. They have high behavioral health needs and have often had numerous experiences with systems and society that understandably influence their behavior and their willingness to engage with us. In the 4 slides that follow, I want to share some data on each of these bulleted points, and each can be impacted by increasing peer services and career opportunities. So with your leadership, Governor, and the leadership of legislators and advocates, Washington has made important legal changes to increase the JR age of jurisdiction and reduce the number of young people who see the inside of a prison. All of us see the need for this change with the scientific advances in adolescent brain development and the impacts of personal and community trauma and recognition of racial disparities with young people in the system, especially those tried as adults. The population we serve is older with changing developmental needs and interests, and we need to match to this. So what you're looking at in this grid is the results of a JR to 25 work group. The role that peers and mentors can play with this population was crystal clear in that diverse group of individuals that met to talk about necessary changes. You see that peer and mentor opportunities are highlighted as priorities across the principles and goals in their report. So young people of color entering JR have already experienced increasing levels of disparity in the legal system when they come to us. The population in JR is the reverse of the general population, with youth of color making up the significant majority. The top 2 bars on this graph are young people in JR. You'll see that the level of disproportionality increases the further a person goes into the system. And young people of color tried as adults are over 3 times their proportion in the general population. So youth coming through JR experience challenges across life domains. So you'll see here the experiences they have in work, in education, in out-of-home placement and child welfare involvement, in housing, and peers, mentors, and community health workers can help in each of these areas. You know, Sue mentioned the expansion of the role that peers can play, and that they are helping individuals to be able to navigate these systems, see the potential benefit of engaging with the systems. I think another really important role that peers can play is when you have an individual who looks like you and shares a background and is credible in your experience, that can also have an impact on the hesitance or suspicion that a person might understandably have given their past experience. So these images provide data on the behavioral health needs of Medicaid covered youth in JR, which is 86% of our population. Most of these youth have behavioral health needs, as you'll see in the box on the left. The top box represents the total percentage. 50% have co-occurring mental health and substance use treatment needs. The middle box shows the percentage of Medicaid covered young people with a need who received at least one Medicaid funded service related to that need in the first 90 days after their release. This means 67% of young people with a mental health need did not receive a mental health related service, and 91% with a SUD need did not receive a related substance use treatment service. The box on the right shows the disparity for young people who are BIPOC in terms of the percentage receiving a service in those first 90 days relative to young people who are white. Now, I do want to highlight that the service data on this slide is Medicaid funded services only. It's not including services that were funded through private insurance or locally funded services. For example, JR Youth releasing to King County may receive substance use treatment service that is funded through local tax dollars in King County. So that's not part of this count. Peers can have a direct impact on increasing access and closing the disparity gap when a credible person with lived experience talks to them about the supports available in a language they can connect with, and when they share firsthand the potential benefits of engaging with those services. So our goal is to dramatically influence these percentages, these post-release services percentages, with behavioral health state funding that we have received to enhance our services through our continued partnerships with healthcare authority that both Sue and Ross spoke to, as well as ongoing partnerships and work with MCOs, community providers, and other community advocates so that we can offer robust supports that match the complex needs of young people when they return to their communities. And we believe that peer counselors and mentors are a key part of this array. And so that's a little highlight of what we see, you know, who the young people are, what they've experienced, and some of the data and how we see that peer mentors and peer career opportunities can have an influence on those things.
Great. Thank you, Ted.
Yeah.
Governor Inslee, do you have any questions? Looks like you're on mute.
Right here. Yeah, Ted, very interesting and alarming as well, the disparity on the access for the BIPOC communities. The obvious question is, what do we think the reason for that is? Is it geographic? Is it economic? Is it cultural? What's the reasons for that, the best we can figure out?
I mean, I think the answer is yes, all of those things. I think part of it is access, part of it is access with individuals and providers that young people experience as a good fit. I think this is part of why peers, as well as transformational mentors who share background, who look like the young people, I think a big part of it is fit. I think a big part of it is, you know, negative experiences historically with the system and the stigma, perception that the system is not matching to their needs. I mean, you know, underlying it all is systemic racism, and how are the ways that we continue to lean into that and transform that and dismantle that.
Got it.
Okay. Thank you again, Ted. Next, we will hear from FELICE Upton from the Department of Children, Youth, and Families. FELICE.
Thank you for having me. I just wanted to talk about commitments that JR is making to this work and why we think it is so important. So thank you for taking the time to hear me. We certainly know that currently we are doing our best and we can do much better. And part of that is opening our doors and understanding the young people that we are tasked with serving. We know we've been trying, and we also know that we haven't always invited community into juvenile rehabilitation, which we are firmly committed to doing. We want to express a firm commitment as an organization to our organizational support at every level of peer engagement. That means opening our doors. That means inviting people with lived experience in. The power of this particular tool is the operationalizing, hello, doing the services that we've always been doing incredibly better. And what that means to me is, as we're releasing young people, often it's with a lot of skills and access that they may not have had previously. And how do you use that to its maximum benefit? How do you know how to use your medical benefit if you've not been taught to advocate for yourself? How do we start to break some of those stigma and procedural justice issues that have existed? We also know as an organization that it takes a village for every young person. And we know that this work is done shoulder to shoulder with our community and people who have actual experience having been in our systems, rather than those of us who may think we understand but don't completely understand. So we are just looking for increased access for people with the understanding that we want to break down stigma, real stigma for the young people that we serve, and are committed to service for each young person who is in JR's care. We hope that they have wonderful lives and that those look as incredible as they want them to look. And we will do that work shoulder to shoulder with peers. I also have worked with certified peers and think that what they bring to the table is incredible, and work that we can't do without them. So thank you for having me, and thank you for everybody who serves in that role, who you'll hear from on this call. Their work is powerful and transformational, and we are just thrilled to be welcoming you in a more significant and deliberate way to juvenile rehabilitation.
Great. Thank you, Felice. We will hand it over to Melody Pazolt from the Healthcare Authority.
Good morning, Governor Inslee. My name is Melody Pazolt. I'm a section manager at the Healthcare Authority within the Division of Behavioral Health and Recovery Services. And my section is in charge of implementing a number of recovery support services, as well as the credentialing body for peer support certification. Next slide.
Melody, if I could have you pause real quick. It looks like we can't see you on the screen right now. Oh, there you are. Okay. Thank you. Go ahead.
Thank you. All of the things that we try and do within recovery support services are really guided by the Substance Abuse Mental Health Service Administration's guiding principles of recovery and the definition of recovery. And you'll actually notice that I have 11 because I duplicated hope, because I think it's so crucial. And I think that's one of the most powerful things that peers bring, is just that message of hope, that recovery can happen, that you can lead a full life, and that having a behavioral health condition does not necessarily mean that you can't contribute to the community. So the definition of recovery is a process of change through which individuals improve their health and wellness, live a full self-directed life, and strive to reach their full potential. Next slide. Go ahead and click. There's a couple of bullets there. And so what is so unique about certified peer counselors? It's really that self-disclosure. It's that I know what it's like to be in your shoes, and that idea of those lived experiences creating a connection. And it's really about that person being able to share their journey, their pathway towards recovery, and what worked for them and what didn't work for them, and that they're there to walk beside that person. I think that peers also have sort of two roles. They're there to support that individual, but they're also change agents within our system. They're there to help our system recognize when we're being not as recovery oriented, and being able to be that change agent within the service delivery system. So they really wear two hats, and that's so crucial that we help and support them and recognize those two hats. Next slide. So the definition of peer support or peer counselor, because predominantly we are focused a lot on the Medicaid reimbursable peer services, it is a service within both the mental health and substance use treatment state plans. And so the peer services are Medicaid reimbursable. And there's really sort of three legs to that process. It's really about the peer being applying to become a certified peer counselor, somebody that self-identifies as having a mental health or substance use disorder, or a parent or legal guardian of an individual that has received behavioral health services. They submit their application to us at the Healthcare Authority. We then process that application, that they've meet that 1 year of recovery, that they're willing to share their story. And then we have them attend a training, and they also then have completed that portion of the process. But to also, for the Medicaid reimbursement of those services, that individual also needs to register through the Department of Health as an agency affiliated counselor and work for a licensed community behavioral health agency for Medicaid reimbursement. We're also expanding other strategies of how to use peers in other environments, but we have been really successful at having these services be Medicaid reimbursable since 2005 on the mental health side, and substance use treatment side since 2019. And again, as Sue mentioned earlier in her remarks, we've certified over 4,700 certified peer counselors since 2005. So one of the things that peers can do, and we oftentimes think about peers as a service, only a certified peer counselor can provide a service, but we also see peers as provider types. And so one of the services that we have been using peers to do is based on this model out of New York called the Peer Bridger model. And it started in 1995, where the New York Association of Psychiatric Rehabilitation Services, or NIAPRS for short, started having peers go into their 22 state hospitals and really start building a bridge and engaging people in the state hospital and being that consistent person with them to walk beside them as they transition from the institutional setting out into the community. And so that peer bridger model is something that we actually implemented in Washington State. And it's really based on the fidelity of the NIAPRS model. One of their taglines that they talk about is, we support each other to get out of the hospital, stay out of the hospital, and get the hospital out of us. Next slide. So we have been implementing the peer bridger model within our 2 state hospitals in Washington State since about 2015. We've been actually working now to provide that linkage to really help engage individuals and then build that bridge out into the community. And the peer bridgers are the consistent person in that person's life as they help that person have a voice in the discharge planning process. The peer bridgers are really unique in that they are part of the discharge planning team if that individual wants them to be a part of that process. And they're really there to help ensure that that individual's voice is heard throughout the process and walk beside them. And so that's really the linkage that the peer bridgers are able to do throughout the transition from an inpatient setting. And now, Governor Inslee, with your charge of transitioning the individuals out of the state hospitals into building more community resources, local psychiatric hospitals, and freestanding evaluation and treatment facilities, we've also started expanding our peer bridgers into those local settings, as well as still continuing to support individuals in the state hospitals. Next slide. So this is just a quick snapshot of some of the individuals that the peer bridgers have served. We have 24 peer bridgers in Washington State currently helping individuals out of those state hospitals. And these are the number of individuals that we've helped transition out of the state hospitals, or the number of individuals that they have engaged with. Next slide. And so some of the next steps that we we see for the peer bridgers, and again, Sue gave a little bit of that glimpse into the future, and that we're starting to make those transitions, but we're also looking at adding peer bridgers to substance use treatment facilities as well as to our jail transition teams. We're also working with NIACRIS on creating a fidelity to the model and really a continuous quality improvement approach so that we're following those principles that New York created when they first invented this model, and being able to work, continue to work and adhere to those principles. We're also working on how do we help host agencies understand the role of peer bridgers. And so we're working to create an operationalizing peer bridger toolkit. And we think that this will be helpful to psychiatric hospitals, to jails, to substance use treatment programs, as well as to those JRA facilities. And so helping the host organization where peer bridgers are going to be going into understand their role and how to help engage individuals within those settings to start be able to build a relationship to help them move out into the community. So that's one of our pledges to work with JRA and give them these tools and our lessons that we've learned from our initial projects within the state hospitals. And I think the next slide is to really turn it over to Heather and Shar in order to really hear from peer bridgers themselves. And so I'm going to let Shar and Heather sort of share what it's like a typical day as a peer bridger. Heather, do you want to go first?
Oh, Heather, you are up
there. We go. I got it. Hi, thanks, Melody. Good morning, everybody. My name is Heather, and I have been peer bridging since about 2016. A typical day for me, I cover a 5-county region and also travel quite a ways to get to the state hospital. So my day consists of a lot of traveling. During that time, I really like to reflect on who I'm going to be seeing, what we might be talking about, really just kind of center myself to get the day started. You know, our work that we do is very person-centered, so it's not typical as far as that goes. When I'm at Western State Hospital, I am, you know, engaging with staff there, social workers, you know, sitting and spending time with my peer, building that mutual trusting relationship, really kind of mapping out their needs and trying to figure out, you know, if they have natural supports, if they've been engaged previously in support systems, stuff like that. Just really kind of building rapport and getting to know each other is what we do most of the time in the institutional setting. You know, when I'm visiting somebody when they discharge, also the real important thing, I don't want to skip over this. A lot of times my folks aren't involved in the treatment team meetings when they're discussing, you know, what kind of a discharge plan they might be going with. And I've seen it many, many times. They let people make decisions for themselves. So one of the big things we can do as peer bridgers in the hospital is really kind of encourage and let them know, hey, if you want me to be there with you, I'll be there with you. And you know, to see somebody empowered to actually attend these treatment meetings and then have a voice and just kind of put out there, you know, what sometimes they don't end up getting what they want, but just to see them be empowered enough to go in there and you know, be involved in these treatment team meetings is huge. In the community, you know, meet with them usually at least once a week. Again, it's person-centered, so that can kind of vary. Social engagements, working on life skills, you know, just connecting them to community resources, attending that first appointment with their provider, you know, the intake appointments, just really being somebody that shows up, is consistent, non-judgmental, is there for them no matter where they're at or what they're doing. It makes a huge, huge difference in people's lives. Big thing about what we do is connecting, not just connecting with the peers that we serve, but connecting with our community partners, you know, hospital staff, social workers, discharge planners, caregivers in the community, their natural supports, crisis responders, activity centers. I mean, we are the little connectors, and building those relationships with the community partners is huge, because I can't tell you how many times I've received a phone call from somebody or another, and my peers having a bit of a challenging moment and they call because the person needs a little extra support, and oftentimes that has enabled us to avoid another hospital stay or avoid going to jail or just whatever. Just having somebody there that the community partners can call and say, hey, here's your peer bridger, and then just kind of walk them through that, support them through that. So the diversion part of it's a really, really big deal too. I love success stories, and I have a ton of them, so I'm just gonna kind of try to pinpoint it down in a general kind of a way. What I've seen being a peer bridger for the last 5 years is when a person's supported well and connected in their community, given their power back to make decisions in their life, and reaping the benefits of those good healthy choices, that's when the magic really happens. I've seen somebody who has spent a majority of their adult life in Western State Hospital, probably 10 to 15 stays. Each time he discharged, he wasn't able to stay in the community longer than 7 days at a time for no other outside influences, like just couldn't stay in the community. Took a really long time for him to be discharge ready. I got to support him and walk alongside him. I get a little emotional. He discharged to a safe, secure adult family home. He began engaging in community activities, really kind of, having a couple chores here and there at the house. And, he's been successfully discharged from Western State Hospital for over 2 years now. And to me, it's I'm not tooting my own horn. I'm just saying the connection is so necessary for them to even just have one person, it makes a huge difference. I've seen individuals who've been primarily unhoused for most of their adult life, be placed in their own apartments through supportive housing. And I've seen them change and have pride in their place and learning how to keep it clean and budget, meal plan, cook for themselves. It's an amazing, amazing thing. I can't say enough about peer support in general. I've always been an advocate for it. It has 100% changed and enriched my own life. And I really appreciate, I know I'm talking to a room full of like-minded people here, and you have all really, pinpointed a lot about what peer support is and how it works. And it's necessary. We need more of it. I think everybody should have a peer. And I think, let's see, I got some notes here because I'm a talker. Yeah, that's pretty much it. I mean, I love what I get to do. I love the people that I get to work with. We're a pretty big state, and I think just the whole connection piece of it is where the rubber meets the road, really. And with that, I will introduce one of my favorite other peer bridgers, Charlene Peterson.
Thank you, Heather. Thank you, Governor, for allowing us to speak today. So a typical day, I do not believe that I have a typical day being a peer bridger. Every day is very different for me. I travel from Clark County up to Western State Hospital, and I stay the night every Tuesday night up there. So I'm there Tuesdays and Wednesdays. While I'm there at the hospital, really my goal, I think, is really to build rapport with the participants. But I also speak with, you know, the treatment teams and other peer bridgers and just support people through their goals and through their journey. As Heather spoke a lot about, a lot of people are not real engaged in their own treatment plan or what's going to happen. I think everybody that I speak with wants independent housing, has no idea what an adult family home environment is like. And so we have a lot of conversations and we do a lot of role playing while we're up there. So it's an honor that they allow us into their life. And it's just an awesome thing. The other 3 days in the community is a little bit different. I get to meet with the participants that have discharged back into our community. I meet with a lot of adult family home providers and treatment teams, and I get to speak with a lot of liaisons and do a lot of paperwork, it seems like. But I spend a lot of time traveling and in my car. And as Heather says, there are so many success stories. Me and Heather started the program from the very beginning. And so I don't even know where to begin. I did take a few notes. So some of it, I have worked with a participant that was in the hospital for over 20 years. He has been discharged successfully for 2.5 years. I had worked with another participant that had 17 hospitalizations, and he has successfully been out of the hospital for over 3 years. Both of those people still contact me by text every once in a while, so that's really kind of cool. And so some of the stuff that some of the goals that I have worked on is like getting driver's license back, becoming their own payees, independent housing, reunification of their children or other families, and as little as making a hamburger. People's needs and goals vary from very large to very small, but they're their goals, and they're always excited when they meet them. So I'm not a huge talker, so that's about all I have. Thank you.
Thanks, Shar. Thanks, Heather and Felice and Melody. Governor, we've got a couple minutes to make up, but do you have a quick question before we move on?
Yeah, I really appreciate Charlene and Heather. Can you tell us, how did you become involved in this program? What inspired you to become involved?
So actually for me, I was on a PAC team for over 10 years prior to this, and the company actually kind of reached out to me and said, hey, we have a peer bridging opportunity. I was unaware that I'd be traveling or what I would be doing, but I liked what it had said in its mission, and I really enjoy working for a peer organization. So it was way different for me. It was really person-centered versus a treatment plan. And I was really ready for the change. So it was a really great opportunity for me.
Thanks, Shar. How about you, Heather?
For me, also the same thing. I mean, since I got into recovery back in 2006, I have been involved in peer support in one way or another. And then I was encouraged by one of my mentors to take the CPC class and become certified. And I did that, and I was working for a inpatient center in Vancouver, Washington, which I absolutely loved because now I'm doing peer support and I'm getting paid for it, which was really cool. And then somebody had reached out to me from Great Rivers VHO and said, hey, there's this job coming available. I think you'd be perfect for it. And my personal story is I've worked with a co-occurring, I could say challenge because I hate the word disorder, you know, and so it was pretty intimidating at first. I'd never laid eyes on the state hospital, but I was completely intrigued. And, you know, when I heard the purpose to help people transition out of the hospital and stay out of the hospital and to get the hospital out of them, it was like, that's what I want to do. Like, that's, you know, that's perfect for me. So, and it has been, I've been able to remain, you know, pretty passionate throughout the last 5 years. It's a challenging job. Not going to say it's not very challenging at times, but very rewarding at the same time.
Great.
Great.
Thank you, Heather. All right, thank you all very much. We'll hear from Ted Ryle again as he provides a work sample as well as introduces us to several of our other partners who are working in this area. Ted?
Thanks so much. Just want to quickly touch on, this is some of the work that we'll be doing in partnership with Healthcare Authority and with support that they're providing in terms of funds. So with the Operationalizing Peer Bridger Toolkit, our intent is to convene a paid group of stakeholders to talk with us about how we can level up in terms of welcoming and readying our system and our staff to do the work. We appreciate the support of the model developers that is being made available by Healthcare Authority, and also we look forward to piloting a Peer Bridger program with some funds provided by Healthcare Authority. This is a work sample. We offer multisystemic therapy as an evidence-based practice with comprehensive healthcare in Eastern Washington. And we modified the contract with them effective July 1 of this year to add a Peer Bridger to that service. So they used to do MST FIT, Family Integrated Transitions, where the clinician would reach in to engage the young person and their family before the youth returned home. And what we're doing with them is adding a peer to that service, so that alongside of the MST team and working in partnership with the clinician will be a peer. And they are recruiting that peer bridger right now. And I know we have some of our comprehensive folks on the line with us today. Sue mentioned, sorry, that was a really short pause. I'm jumping to WISE now. I'm finding myself wanting to accelerate to give Spark plenty of time. We've been at the table with the WISE work, collaborating with HCA, MCOs, and community providers to increase access for JR youth to WISE. And recently, we got a grant from the Office of Homeless Youth to create a WISE coordinator position dedicated to that work. And we also, through a subcontract with Castile Williams and Associates, an African-American provider in Pierce County, we were able to employ a peer engagement specialist who went into the facilities to talk with young people about WISE. And you're going to hear from that young man really soon, because he's now part of the Spark training team, Mr. TYUS Reed. And moving on to the next slide, this shows the data over the years of referrals of JR youth in WISE. And so you'll see the increased trend. And then if you look at the last two bars on the right, that is the result of the work that TYUS and Tara Beth Crowder, our WISE engagement coordinator, have been doing in partnership with community providers and our mental health coordinators, over doubling the number of WISE referrals of youth in JR. And that trend continues into 2021. Next slide. So another really important work sample is this project with Spark that is training 21 young people right now. They actually are in the midpoint of the project with young people from 3 institutions and 3 community facilities across the state who are interested in the peer career opportunity. And that's all I want to say, because I want to hand it off to the Spark team to introduce themselves and tell you more about the work.
Thanks, Ted.
Thank you, Ted. Hi, my name is Carolyn Cox. I am the founder and executive director for the Spark Peer Learning Center in Kennewick, Washington. I am also a state trainer for the Family and Youth Certified Peer Support trainings. And I have been a peer counselor for, oh my goodness, since 2006. And my family is also a recipient of wraparound services in the state of Washington, and it kept our family together. So I'm very, very much a proponent of peer counseling. And I get the privilege of working with young people every day. Our program works with youth ages 17 to 26. Sometimes we actually go up to 30, because we have some folks that are like, we really want to take this class. So we will work with them, and we have developed a pathway to learning about how to become a certified peer counselor in the state of Washington. And we work very closely with the WISE Workforce Development team at HCA. And we also sit on various committees, the Transitional Age Youth committees. And we have been just doing a lot of work with getting youth, especially youth of color, an opportunity to talk and speak about mental health and substance use disorder. And so we have a curriculum that they go through to get started with social and emotional development, and also to talk about how our brain works as we grow. And we kind of get some fundamentals down, and then we move into how then do we use our lived experience to work alongside another person and instill hope, empowerment, and instill resiliency within that youth. And we started at New Horizons High School. It is an alternative high school in Pasco, Washington. And in fact, every employee that I have here is a graduate from New Horizons High School. So I am surrounded by youth every day, and I love it. They are amazing. But I'm going to pass it along to Maria Nunez and TYUS Reed, who are two of our just amazing youth leaders for the Spark program, and I believe in Washington State. So.
Thank you. Hi, I'm Maria Nunez. I'm the program manager and co-owner for the Spark program. I actually started this work about 3-4 years ago with Carolyn at New Horizons High School, where I met her. It kind of started off with me meeting her about 4 years ago. She was helping me with the situation that was going on. You know, I am a mother of two, so I was in high school, had my little 3-year-old, and then I was pregnant with my second one. And something that I really wanted to do was figure out what to do with my future. And, you know, trying to be able to graduate while still being a mom and be working. So I would always get a lot of questions from other mothers that, like, first-time mothers that were in the school on advice and, you know, how do I do this? How do I get into this program, or how do I get help? So being able to be that advocate for the moms there, I kind of went into Carolyn's office and I was like, what is it that you do? Because that's something I want to do when I'm, you know, since once I'm done in high school. And we kind of started talking about the peer counseling. She took me into a Peer Pathways conference back in 2018. And I had just had my little baby. So I had my 3-year-old and my little 2-month-old. So I went to the conference with her. I was able to share my story with her. And since then, you know, the Spark program started. The idea came up on what we could do to get peers into schools and train youth that are in high schools to come out and be able to get a job as a peer counselor to help youth that have the shared experience and shared lived experience as well. And since then, we worked on the development team. I worked on the development team for Spark, and I have been growing since. I've done many presentations and conferences, keynote speakings. I'm able to be part of some amazing programs. And it's just been a very great benefit, and being able to expand this to Washington State has been such a big thing. And it's something that I'm very passionate about, being able to have someone, you know, that looks like you to have like walk alongside of you as well. And I did work as a certified peer counselor for a bit, and just seeing the success stories and being able to hear them and see them grow within themselves, and see that, you know, someone does believe in me and they're carrying the hope for me, and just to make a better impact as well. And what I'm really excited about the GR that we just started this month, is being able to bring peers into their incarcerations into the GR, and being able to train them to be peer counselors, and also for once they get out, they could go back and be that person that they could relate to, and just bring that extra, you know, the extra hope, and see that if someone else could do it, they could do it as well, and just carrying that hope for them. And it's just an amazing program, and I can't wait for the growth of it. And yeah, so I'll pass it on to TYUS Reed.
Thank you, Maria. Good morning, Governor Inslee. Good morning, everybody on the panel. I want to thank you for having me and my team over here. And also, I see a couple youth on the call that I know. Thank you for having us. This is an important platform, and it's very important that these calls take place. What I want to speak about is the importance of peers in the system and how peers in the systems can work together for the greater results, and also what we're doing in the Spark program in JR. So a little bit about me. I was in JR myself. I did 5 years and even did some time in DLC. And in the beginning of my time, in the beginning of my JR sentence, I had my peer and I met my peer. And I remember she was telling me, you know, TYUS, you can do what I do one day. And this is me sitting in there with my jumpsuit and my orange slides on. And I just, you know, from that conversation forward, a light went off in my head, right? I've never had those words of encouragement and support and love and like a genuine person who's not in my family who wanted me to do good. That was foreign to me. I never experienced that. And coming from a peer, you know, closer to my age, close to my culture, it just really hit home, you know, like I've heard it from my family, my mother, my grandmother, my whole life. But, you know, coming from a peer, it really made me stop and think because, you know, why is this person telling me this? They must be telling me this because it's true. They get no benefits from it, right? So from that conversation forward, a light went off in my head and a fire got struck in me to continue to do this. And I'm now in my second position. I've been out since 2018 and, you know, we're getting rolling. And, you know, I'm proof that when systems and peers come together, you know, the sky is literally the limit. You know, my peer mentors, they've helped me grow into an adult. They helped me realize that my story and my hardships that I was going through at that time, I can use and I could flip the script and I could first use to save myself and change myself because I'm a firm believer that, you know, you can't help others unless you first get yourself right and help yourself. And second, giving me, you know, that fire and that information and that support to give to other youth and help them change their lives also. And if equally importance is my system mentors. I also call them system peers now because now they are my peers that I'm in this field and some of which are on this call, you know, like I said, of equally importance because what they taught me was how to turn how to professionalize my lived experience, right? How to, you know, formulate it and how to be on calls like this and develop curriculums and use my knowledge and put it in a professional manner. You know, and also opened up doors for me like this call itself that, you know, I would have never imagined would be open for me, right? And so just like I said, you know, when systems and peers come together with a common goal, you know, we can make calls like this. And, you know, that's the reason why I'm on here talking to you today. So that brings me into, you know, college degrees, you know, diagnosis, statistics, languages, all extremely important. There's the foundation of what we know of, you know, humanity and years of, you know, gaining this knowledge, right? And it's important, but it's of no use if one, as me as the youth, I'm not listening, and of two, if I don't understand what you're saying. And to me, that's the beauty of peers, right? And it's really, you know, peer bridgers, peer counselors, it's all one, it all ties into one because, you know, I'm giving it to the youth in a way like, you know, hey, this is post-traumatic stress disorder, this is this, but really this is what it means. And this is how it correlates to your real life. And this is what, you know, this is how you can use it to help your real life situations and help you. So, and then number one, getting them to listen, you know, that's the first, that's like I said, that's the first, you got to open up them ears. And when they see somebody around their age who looks like them, who speaks that language, who knows what's going on in the culture, social media, knows what's in the music, they got no choice to listen. Even if, you know, it's, you know, they don't want to, they're going to open the ears and some of that stuff is going to catch. And you just got to keep being persistent because that's what worked for me. Also, one of the questions that Mr. Ryle answered earlier was all those things are extremely important with the, you know, racial disparities and the lack of, you know, these things being offered into the, you know, our communities. But what I think what would help me and my community and other communities of colors is putting the right stuff out, right? Putting the right products out and having the right people deliver it. That is just extremely important. And, you know, I already know it's already taking place, but, you know, if we could just get it more these communities involved in this stuff, you know, before we put it out, you know, seeing, you know, what they, you know, what they need, what hasn't been working, what has been working, and, you know, getting the community more involved in these organizations and these things that we're putting out. So back to what I was saying about the Spark program, we're in Spark, we're in JR, we're teaching the classes, we're giving them the knowledge and the credentials to get out, to get a job, to sign them up for the certified peer counselor training. And, you know, to me, it's this is my wildest dreams. And for other people in my community, I know it's the same thing. We never would have dreamed about having a job with a 401k, having a job with health insurance. And, you know, like I talk to people that I work with and, you know, they're like, wow, you never thought about that stuff. But coming where I come from, that's not, you know, that's not talked about. So, you know, just, I mean, this is just a great thing that we're doing, and we're getting to them while we have them, right? We're getting to them while they're in JR, you know, while they're all the outside world, you know, stuff is not present, and we're getting to them, and we're, you know, we're getting them out there, and we're getting them that knowledge before they come home. And I think that's just what is extremely important, and it would have helped me when I was in JR. So thank you for having me on here today, and I appreciate it.
Thank you. Thank you so much. Governor, do you have questions? Oh, sorry. Governor, do you have questions for TYUS or Maria, Carolyn, Ted?
Yeah, I guess a question, what's most effective when you first develop a relationship with folks? You know, you're a stranger, you're coming into their life. What works to give them confidence that you can be helpful to them and you're not just another interloper trying to, you know, put them in the strictures of civilized, you know, I mean, what works in that regard?
I'll take my answer. I think what my peer counselor gave me is like unconditional support and love and like information. Cause, you know, I'm speaking from my experience in my community. There was not a lot of older adults that ever talked to me about like, you know, doing positive stuff and how I can go about it. So really what touched me and what opened my eyes when I was a youth with my peer is just the support and the love and the confidence. You know, when you have somebody that you care about and you know that they're backing you up, you don't want to disappoint them, and you want to make them proud in a way, and you know you want to yeah. So really, it sounds simple, but you know, just support, love, and knowledge, I think.
Got it. Well, thanks for your guys bringing hope to some folks that could use it. That's pretty encouraging.
Yeah.
Thank you for having us.
Thank you.
Thank you all so much. So up next is Jose Niners Garcia from Hope for Homies. Niners is joined by youth from Echo Glen.
Hello there. Hi, my name is Niners. I'm the executive director of Hope for Homies. One of the things that I've first, thank you guys. Thank everybody on this on the screen. Thank you, Governor Inslee, my team, and everybody. So coming as a marginalized Hispanic, I was up against a lot. I grew up in an environment where there was constant this, you ain't good enough, you ain't this, you ain't that. And to top it off, I had a mother who was constantly being beat up by my dad, or constantly in relationships. And then to top that off, I didn't speak English. English is my second language. One of the biggest things with myself is I didn't have the privilege of going to school to be able to understand how to communicate with folks. So I had to gravitate to what I knew. And my sister started seeing me that I wanted to be hanging out with the homies and stuff out there on the streets. And so one of the things is I started watching her bring me books, telling me to read, telling me to do this. I was one of 6 kids. So my mom was constantly working, the youngest one. She's got me to watch shows to understand the language, understand the body movement. So I watch shows that a lot of folks that don't watch nowadays, like Happy Days, Welcome Back Kotter, Three's Company, all that stuff. You know, I wanted to be like Jack Tripper and stuff. I wanted to be like Thurston Howell III on Gilligan's Island. You know, I watched John Travolta before he became famous. You know, I watched all that. And so that's what really helped me understand, you know, I wanted to be like Kevin, get his heart broken by a girl on Wonder Years, you know, I wanted to do all that. And so one of the biggest things, I started gravitating to what I lacked in my neighborhood and what I lacked in myself. And so at age 10, I got sent to Echo Glen. 10, I was here till I was about 11 and a half. Got sent up to Fairfax Mental Hospital. They didn't know what to do with me. My mom had forgotten about me, got out at 12, got shot 6 times, hit 4 times in the back, legs and hip. By the time I was 13, I already had my first daughter. By the time I was 14, I was in Green Hill. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. July 20th, 2014, I got released from prison from solitary confinement. I was one of the last persons to get released from solitary confinement before it became inhumane. I was released straight to the streets with no support. I went straight into trying to figure out how to survive. So I realized a lot of stuff that we lacked in our neighborhood from hearing conversations in prison, from watching people struggle in there, that I gravitated towards like the conversation, how to help out. So I started working on how to help in my community. First was I did community gardens for a church in Burlington, Washington. I started doing little gang outreach stuff. And I slowly started developing my support. Again, I didn't have no trade skills, didn't have no education, straight out of prison. All I could think about was, how am I going to help my community? I spent a couple months in monasteries trying to find myself, and I realized this is something that I wanted to create. So we bring hope and purpose to those on the margins that are affected by gangs or affiliated, or the community that's impacted by it. This is my team. 2 of the individuals on the right are 2 of the guys that finished off 21 years in prison, another one 20. I give everybody that comes out of prison, this is our youth group. One of the things that I created in our organization is this thing called Hoods in the Woods, where we take them out of that 4-block radius, where if all you see is all you know, that's what you're going to gravitate to. So I created Hoods in the Woods. We partnered with Sheriff Adam Fortney out of Snohomish. We partnered with other folks. We partnered with Debbie Cadell from Tattoos Removal to remove facial tattoos. I know that's an identity that helps us survive as children, but we're in a whole nother path. We create mentors and leaders out of all of our folks. Every one of our navigators has been through the system, has gone through the system, and is trying to change the system. We come here now, my navigators, and create these opportunities for those coming out of here. I'm in Echo Glen right now. I constantly try to engage and be a part of the community with Echo, and I'm really grateful for Amy and Felice for allowing me that opportunity. We've created positions for any guys and ladies coming out of the juvenile system to come work with us, to come navigate. We give it to people in DOC to come out and be able to get a breather, be able to like focus on themselves before they jump into the mainstream of population. We now have Mr. Loya, who finished off 20 years. He will be now going off to union, got the license, got the car, an apartment, and we could finally get him in the union. We're working on getting as soon as Miss Tatiana gets out of JRA, we'll be able to have her a job, employment, where she'll be able to get herself slowed down, spend some time on herself, think about what her plans are, look to the future. I believe we no longer can tell our kids in this community the stories that we used to tell that our grandparents used to tell us about going up both ways to school in snow with one sole in our shoe, pants ripped, and one shoelace. We can no longer do that no more. These kids have gone through something that none of us have ever gone through. The whole world just shut down on them. The whole world did. They didn't know whether their parents were going to come home, whether they were going to have jobs, or what was next. We customize all our lessons, everything we do that's fit to the folks that we're serving. We created we created kinship within our community. We believe we are servants to kinship. We pick up guys from Green Hill, give them that opportunity. We go speak with Brian Stevens in Nashville and Lipscomb University. We try to make sure that we constantly remind folks we are here to serve. I believe there's only one leader, and that's our higher power. So we can't no longer use our concrete method that we've been using for years. because I am a product of my environment. I am the person that was stuck in the system, in the hole, and did all that. So with that, I feel blessed and privileged and honored to be able to have Ms. Tatiana say a little bit. So thank you.
Okay, hi, I'm a little nervous, so bear with me.
I'm nervous too.
You're good.
I'm a resident at Echo Glen. I've currently been incarcerated for a little over 2 years, and I get out in a few months. I think that something that's crucial to my release is going to be able to have someone there to support me. While I've been in here, I've gotten the opportunity to meet NUNEZ from her homies and TT, Shara. You know, we have our team here, and I'm just blessed to be a part of it. I think that me being 22 in JR, I am, you know, one of the older girls on campus, and a lot of people look up to me, you know, and I want to see everyone win. I want to see everyone do better. And so NUNEZ runs groups here, and he's allowed me to become a peer support and help facilitate the groups within the girls units in my facility. And I found something that I can really, you know, take with me and just to help everyone around me with my own experience. And I think that it's just really important, just for the simple fact that when I get out, I was thinking, like, what am I going to do? You know, I was charged as an adult. I'm a felon. You know, I don't have too many opportunities. I have all these barriers, but I have one of the greatest opportunities. And I think that is to be able to speak from my heart and to be able to help others with what I've been through. And so I need, you know, that support. And also I want to be that support. You know, I'm also taking classes, or the Spark class. So I work with Carolyn and TYUS and Maria as well. And I'm hoping to get certified as a peer counselor. And I think that all these things have just really opened my eyes to my potential. I've always, you know, I've been in the system for about 9 years, and I've been incarcerated for more times than I can remember. And I've always like wanted to do better, you know, but this time I really know that I can, because I have all these support systems, and I have, you know, I found my footing, and I've created a plan. In our groups for Hope for Homies, they've just planted these seeds inside of me that have helped me, you know, fill these voids of like where guidance should have been and where hope should have been. And, you know, they've helped me find these tools to uncover my trauma and uncover my past, and to be able to move on from that, and to be able to use that to empower others, as well as, you know, just empower myself every day. I get up with a purpose now, and I know that once I get out in a couple of months, you know, I'll have that purpose to give on to others, and just to be able to walk with others. You know, it's just like really crucial to me to be able to get out and to have something to look forward to. If I didn't have Hope for Homies or Spark, or, you know, even people that such as FELICE Upton and Amy Turi, and, you know, some people that are in my facility, I think that I wouldn't be able, I don't know where I would have went. I don't know how I would have, you know, got out, and I probably would have went back to my same neighborhood. And, you know, if all you see is all you know, I couldn't say that I would have broke those patterns, but with all the support and motivation, I definitely have no option to fail. So I just thank you for this opportunity. And even just being on this Zoom call right now is just, it just proves and it speaks volumes that, you know, I can become something way bigger than what I've ever been. And for NUNEZ to have been through my shoes and to have made it is extreme motivation. So I just really appreciate this opportunity. Thank you.
So we're going to introduce Ted next.
Thanks a lot. We just, you know, this work, you know, NUNEZ, TYUS, the other folks on this call, you know, who we're hearing from are transformational mentors, you know, people that want to change the world. And, you know, folks like that who look like these young people who have the shared experience, we know they make the difference. You know, TYUS said that's job one. That's how we connect with these young people. That's how we help them see hope and opportunity. And we just wanted to highlight one other program that's happening down at Green Hill right now. Sue had mentioned the idea of nothing about us without us. A group of young men, many of whom returned to Green Hill from DOC facilities when the law changed, worked with relevant engagement and a man named Rashad Norris to create a program called Made Men, Making a Difference Every Day. And they are, Rashad worked with them to develop a training program to train mentors, and they're going into units across campus at Green Hill School. And leaders in those programs are noticing a huge difference when the made men are in their unit. And so just other really powerful work. And so now if we could just go to the slide after the pictures. This slide just touches on the work that we plan to do over the next year. And, you know, I just want to close by saying how incredibly excited I am about this work. It's near and dear to my heart because, like some of the folks we've heard from, you know, I ran the streets raising hell as a troubled kid. I spent most of my adolescence locked up in 4 different JR facilities. I'm a person in recovery from massive struggles with alcohol and drugs. So I know what it's like to feel hopeless. And I know how transformational it can be to see opportunities and to have support in making them a reality. And that is what this work is about. And I am deeply grateful to all of you for your commitment to the work and for the powerful messages that you shared today. So thank you so much.
Thank you. Thank you, Governor. Do you have any questions for Tatiana, NUNEZ, or Ted?
Yeah, first off, I want to tell you, I want to thank you. This is such an inspirational conversation we've had. You know, when you're a governor, sometimes you get down on occasion because of COVID and climate change and everything else. But I got Tatiana and NUNEZ, Ted working on this to give us hope. And so you've given me some hope. And I appreciate that. It's a little gift you gave me. It's sort of like Christmas in September. So thank you for that gift of inspiration. I do have some questions. First off, NUNEZ, why would you ever be appreciative of Thurston Howell III in the Gilligan? What led you to think that was your lifetime's aspiration? Everybody knows the professor was the cool dude. What were you thinking?
It's because he was on the island, man. He was sitting near Peladas, and I was in the neighborhood getting shot at. I mean, I figured I'd try to get as far as away as I can from this world.
You know, whatever you did,
he was locked up in Steelers with Skipper.
Whatever you did worked. So I'm glad that you had aspirations. Serious question, Tatiana, can you become a peer counselor while you're where you are right now? Is that something you can get engaged in right now? Is that possible?
So I am a peer counselor right now. I'm just not certified and I'm not paid, but I am a peer counselor and also just like a supporter while I'm in here. I think that Ted and Spark and NUNEZ, they're all working together to make that possible while we're incarcerated. I get out in a couple of months, so I don't think that I would have that opportunity, but I would love to see it for the people that are behind me.
Well, it's very encouraging that you're thinking in these terms. You obviously are eloquent and inspirational, and it would be wonderful if you can use it in this system. So I'm really encouraged you're thinking about this, and I know Ted will try to find a way to make that happen. So.
And actually, some of the young men in the program at Green Hill, there have been arrangements made where some of those young men, if they're eligible, are able to be paid as mentors to their peers through DVR funds as work experience. And so I think there are opportunities, and Tatiana and her peers in the Spark program are being paid to be a part of that project team.
Yeah. NUNEZ, what do you think the scale of this could be? Like, you know, you serve X number of people now. How big could this be? Or, you know, if we had infinite resources and infinite mentors, what's your assessment of that?
I think I look at, I believe that it could be as big as we allow it to be. You know, it's not about quantity, it's about quality. So if we serve them with the best and we really go deep internally and really figure out what's the healing method for them, like what really needs them to heal. Because I can give someone a car, job, and everything, and they'll relapse or reoffend. So I really focus on the internal part of it. So we create healing circles. So that's the biggest thing for us. So that's what I believe. I believe it can become phenomenal. It could be a chain. I mean, I'm in NACEL. I'm all the way in Othello. I'm all over. I'm one man with a team, but we're all over, and we try to create these avenues and outlets for others. But that's just my belief. I mean, some might have others, and I'm all about serving the community and serving people like myself.
Great.
I hope that answered it.
Yeah, no, I mean, that's an honest answer. And I think you have articulated why we're excited about this program. We'd like to see it grow. And you guys, I hope we look back 10 years and think that you are in the sort of bottom floor of a growth opportunity here, because I do believe in the power of what you're doing. It's a certain kind of magic. So we want to find a way to expand it. Ted, what's the best thing to do to expand? What's the most important thing to do to expand this in your view?
Well, it's, you know, the NUNEZ and his team, there are lots of amazing teams in communities around the state. And I think, you know, having those relationships and partnerships with people who are embedded in communities that are connecting with us and reaching in and establishing those relationships and then being there to be a support in each of those communities, you know, I think that's the step forward. I think the immediate next step is us bringing groups from communities in to have this conversation about how we operationalize peer support and transformational mentoring to help us learn about what are the things that we do that get in the way. And how do we level up as a system to throw our doors open and strengthen those relationships and be, you know, really strong partners with people in communities in the work.
Well, we'll look forward to a chance to do all those things.
All right. Thank you again, Tatiana, NUNEZ, and Ted. And thanks to everyone who attended the meeting today. As a reminder, as you close out, please do make sure that you take the survey that pops up. We're so appreciative for the partnership with the Department of Children, Youth, and Families and the Healthcare Authority. And a huge thank you to Ted, Felice, Melody, Heather, Charlene, TYUS, Carolyn, Maria, NUNEZ, and Tatiana for being a part of this work. Thanks to the Results Washington team and our leadership. And Governor, I will turn it back over to you for closing comments.
Just comment, there's a lot of reasons for hope here, and bringing this talented pool of people who might be the most talented people in the state, because they are peers, they've walked it, they've lived it, they know what it's like to be in that situation and what could be more effective. So I'm going to look forward to all of us trying to figure out how to way to expand this and make it available to more people. So I want to thank for everybody that, you know, lighting the candle of inspiration here. This is a bright spot in the state of Washington, because we know we got a lot of talent out there if we give it a dose of hope and a little confidence and a little love. So thank you for helping us out on this goal. And please get vaccinated. By the way, talk to your friends about that, okay? We want to keep you alive so you can become a mentor. So everybody be well. Thanks a million, and enjoy Gilligan's Island. It's my favorite.
Thanks, Governor. Thanks, everybody.
Okay, we'll see you guys. Bye-bye.